I wish you all a good morning and a good future. This is an exciting day, I think, and I'm also very pleased to be here today to be able to talk about something that has been part of my personal mission for decades. When I became governor, I began discussing with the legislature and stakeholders about the need to integrate behavioral health services in acute care. Those meetings spurred significant discussions about integration within our community, and we've seen a lot of movement toward clinical integration. Our gathering here today is a great example of that. Bringing acute care and behavioral health services together will ensure that SMI patients get the care that they need. To help make this approach a reality, Arizona received a grant from the Centers for Medicare and Medicaid Services to plan for developing integrated health homes for persons with serious mental illnesses. Access and the Department of Health Services are working together on this project, which includes planning for a fully integrated system. Thanks to Magellan and Maricopa Integrated Health Systems for coming together in this worthwhile partnership. It's a partnership that reduces utilization of inpatient hospitalization, reduces use of behavioral health crisis service, and reduces illnesses associated with preventable chronic conditions. And most important, it will improve the quality of care for the patient with a serious mental illness.
There are some significant challenges of living with a serious mental illness, not only in Arizona, but in any state in our nation. And I want to share some of the startling and alarming national statistics with you. On average, those living with a serious mental illness die 25 to 30 years younger than their peers. Here in Arizona, it's actually closer to 32 years younger. Most of these individuals have significant physical chronic health challenges, such as diabetes, heart disease, and hypertension. Approximately 70% of these individuals have at least one chronic health condition. Approximately 45% have two chronic health conditions, and almost 30% have three or more chronic health conditions. At least 75% of these individuals smoke tobacco. 15% have diabetes. They're 6 times more likely to die by suicide. And they account for 12 million visits annually to emergency rooms around the country. So these are definitely concerning statistics, and the impact of them on the health of this vulnerable population must be addressed, and must be addressed soon. At the Arizona Department of Health Services, Division of Behavioral Health Services, our vision is that physical and behavioral health care be seamlessly integrated to improve the overall health, wellness, and quality of life for individuals with serious mental illness, especially for those 14,000 adults with serious mental illness living here in central Arizona. Many of these folks do not receive adequate physical health care, and there's a number of reasons for this. They find it difficult to navigate the multiple complex healthcare systems in our state. There's discrimination and previous poor experiences with the healthcare system that discourage them from regularly seeking primary health care. Symptoms of mental illness can make it difficult to communicate with or feel comfortable with a primary care physician. And there can also be social barriers to care, including residing in a group home setting, difficulties with transportation, or past experiences with victimization and trauma. In the meantime, the partnership and the effort being announced here today is truly exciting, and I commend the healthcare organizations involved for their vision, their leadership, and their commitment towards implementing this specialized practice integration model.
I want to start by thanking Governor Brewer, Dr. Nelson, and Richard Clark for your leadership for helping those in our community that have mental illness. We will be working with Magellan and the Division of Behavioral Health Services over the next several months to begin providing primary health care services to persons with serious mental illnesses in clinics like this one. This is a noble project, and I am very proud that MIHS is a part of it.
The Maricopa Integrated Health Home Project will provide individuals the opportunity to have a person-centered health home in a single location to address their mental health and their physical health challenges. It'll give them the opportunity to participate in wellness and prevention programs, to receive training and support to move self-management and self-responsibility forward, to receive an integrated whole health individualized service plan, and to receive support and encouragement from the best practice peer support specialists from these clinics that will be participating in this as we understand their journey and their recovery and we support people moving forward. Magellan, Maricopa Integrated Health Systems, Behavioral Health Department has the expertise and experience with individuals with serious mental illness in our community at the community level. I'd also like to thank Christy for hosting us today, Partners in Recovery. This is a marvelous facility, and when you walk into this facility and it's so open, it is so welcoming. It's the kinds of environments that we want to see these integration efforts occur in. I just want to personally thank you for taking the leadership to begin to conceptualize new ways of thinking about how our clinics operate and how they look and feel. I'd also like to recognize our partners, Ron Smith, CEO for Choices P&O Network, Tomas Leon, People of Color Network, and Amy Henning, Southwest Network. Without all four of these groups coming together to commit their resources, their time, their innovation, and their excellence to the efforts that we have, it would be extremely difficult to create behavioral health center-led medical homes for individuals suffering the challenges of a serious mental illness. How will we achieve that? We'll achieve that through a set of core 14 essential elements. They range from an integrated service model and continuity of care record through shared governance and shared allocation of resources, applied and consistent focus on efficiency and system outcomes, an increased emphasis on primary prevention, health and wellness, peer supports, strength-based service delivery at the community level, and through a series of principles dedicated to supporting the individuals in self-management, self-support, peer and family community integration.
One of the key ingredients really for the success of this endeavor is the active involvement and support of peer recovery specialists and family members for those individuals who will be receiving their integrated care at this facility and others. Peers are actually consumers of mental health services. They're people who get services in the system. They're specially trained. They're hired to work in the system, really to serve as a beacon of hope that recovery can and does happen. Together, we've been actively involved in bringing peer and family support to the forefront in behavioral health services in this state. So I'd really now like to introduce a person who can speak firsthand about what the real possibility of the integrated care health home model will be. Ms. Carla Bracey is a peer. She receives services here at East Valley campus, and she recently participated in one of our health risk assessments.
I'm Carla. I'm a mother of 3, a student, and I have a serious mental illness. I was diagnosed with bipolar disorder and depression when I was 20 years of age. If that wasn't enough challenge, I have also struggled with several physical conditions, including diabetes and hypertension. I've also struggled with my weight. I'm looking forward to having an integrated health home where I can currently receive mental health services. It will make it easier to manage my physical issues while progressing in my mental health recovery. I'm in a good place now, thanks to behavioral health system. I'm working on getting my GED so I can become a peer support specialist. Thank you for your opportunity to briefly share my story today and my excitement for the integrated health home. Thank you.